Rosie, thank you. Good afternoon, everyone. I come at this from the health policy perspective, which is my background. And I wouldn't want you to think that because I've written a book about wellness that I'm part of the industry flogging a book. So much so that if you all get your mobile phones out now, take a picture of that quickly, come on, I've only got 7 minutes, take a picture, there he is at the back, and you can all download a free copy of the book right now, right this afternoon, for free, courtesy of the Health Services Management Association. Okay, you got that? Fine, good? Yeah.
Right.
So, thank you. That's the advert out of the way. Now, the book itself started its life in another book. My co-author and I, Ed Smith, who is formerly the chairman of NHS Improvement that was merged into NHS England, we wrote a book called 200 Questions for the NHS, and it was a management book, really, that challenged management with what we thought were the 200 important and principal questions. We realised very quickly that having written the book, it was a complete waste of time, because until the NHS addresses the fact that 50,000 people join the NHS waiting list a week and less than 50,000 come off the other end, it's really a complete waste of time. We have to figure out what we can do to stop people getting sick in the first place. And we looked at the difference between public health policy, which has sort of disappeared somehow up the back passage of the town hall, and with no budget, and public health professionals really are nowhere near influencing policy in the way they should. The difference between public health and public wellness, and we think there's a difference, and the wellness is to be found at the coincidence of four elements which we discuss in the book. The first is the role of legislation, benign legislation. If you think about public health initiatives that have worked, they've all involved the law. Crash helmets on motorbikes, seatbelts in cars, smoking in the workplace, health and safety legislation. Those are the ones that have had the huge influence on public wellness. That, of course, leads us into the moral and ethical dilemma of the freedom of the individual and the ability to choose. So we discuss that in the book, and we talk about the smoking battle that Tony Blair had with smoking, and of course he didn't introduce a smoking ban. This is the interesting thing about that. What he did was he said we will make some places smoke-free. And there's a big difference between banning things and making places so free. So it's about the public narrative and how you do that. And we also discuss in the book, in a chip shop, because the book is full of stories, we discuss the difference between a 5-hole salt shaker and a 17-hole salt shaker, which you'll have to read the book to see what the benefits of the two salt shakers are in our diet. We then moved on to public acceptance. It is interesting how some elements of public policy capture the public imagination and they accept them, like, for example, the plastic bag thing that we have. Now, the plastic bag thing is supposed to raise money for charity. I've never seen really where that money goes. But the cunning supermarkets have introduced things like a bag for life. Now, at my age, I don't buy a bag for life because I don't think I'm going to get a return on investment. But a lot of people do buy bags for life, and people don't realise that actually the supermarkets make a profit out of bags for life. There's a difference between the two. And so we discuss the impact of public acceptance in public policy. We then talk about supportive technology. I mean, you can't write a book about policy these days without talking about technology, but there is a lot of it about which is pretty junk, to be honest, and snake oil. But there are elements of supportive technology that we find in other places. We discuss in the book a family moving house and how they ring up Pickford's. Other removal firms are available, but they ring up Pickford's and say, will you please send over somebody to do a quote for us moving? And they say, we don't do that anymore. They press on their mobile phone on a link. It lights up a kind of FaceTime thing. You walk Pickford's around your house with your phone, show them what you've got, and they send you a quote within 2 hours. Now, that kind of technology can be transferred into social care. One of the big problems we've got at the moment is discharge. The only problem that the NHS really has is its relationship with social care. If we could fix that, it would free up a hell of a lot in the NHS. But all of the problems there are with discharge involves at some stage or other doing some kind of assessment of people's needs when they go home. Getting the home assessment done is a big part of the problem. We could use the Pickford's technology with a neighbour or a relative, and that would make a huge difference, because if you can get people home safely, you stop them getting sick and getting back into hospital, and that's all part of the wellness regime. And finally, we look at the collaborative leadership model. Henry Mintzberg wrote a book. It's called Beyond Leadership. We reference it in the book, and he talks about communityship, a different type of leadership. At the moment, most leadership in health and social care is based on the heroic model of leadership, and inclusivity is very difficult. Mintzberg describes very well for us, and that's why we pitched all of his work, the Beyond Leadership model, the communityship leadership, which those of you who know about the NHS, we've moved now into integrated care boards. And of course, I've been in the NHS for 50 years, and I used to run an integrated care board. In those days, it was called a district health authority, and everybody used to be able to get round the table and talk about things. Yes, I've got the red card here. Okay, thank you very much. Thank you. I know you've stolen my thoughts, you see.
No,
you've put me off.
You're in flight,
So those are the elements that we look at in the book. We come at it. There's lots of examples in the book how wellness works. Just quickly, there's one example from Japan where employers are obligated to provide annual health checkups for their staff. Guess what? The health service in Japan spends less than we do per head of population, and has better outcomes. So we know that it works. So I come at this very differently from my co-panelists, but we come at it from the practical element of how do we stop people getting sick in the first place. Thank you, Chair.